Hi, this is Dr. Tarek Adra, founder of myKinetix365.com, and this is my friend, colleague, and top movement therapist, Courtney Munch. Now, we decided to do a YouTube video for gamers because we feel that they are somewhat not taken care of. Courtney, not yet. Yeah, okay. She's very excited to show you all the bad positions you're doing. But I'm a gamer myself. Courtney has worked in gaming. She's done tons of work with, I don't know, can we mention the games?
I've worked on some Naughty Dog games. And,
okay, there we go. Okay, perfect. So can't say more than that. But what we do know is that because of our involvement with gamers and gaming, we do know that there's a lot of injuries that happen in gaming, especially at the professional level, that are not talked about. The most common one is the wrist. Why? Because the wrist, carpal tunnel, all that stuff, this is kind of your athletic tool. You're an athlete, and that is your athletic tool, and you got to take care of it. Now, most people don't know how, or they might not link the fact that the wrist hurting during gaming somewhat is attached to their habits that they do outside of gaming. So we're here to tell you how that is. And not even, she's very excited to show you all the things you're doing. But also you might have neck pain, headaches. All of these stem from like that, those what we call static strain, holding a position for too long. Or repetitive micro trauma, doing something over and over again until something breaks. So first we're gonna show you could be what you're doing wrong, how to ideally fix it, and then we're gonna give you a couple of tips on how to maybe reset the button a little bit, give you more endurance while you're doing what you do very well. Courtney, yes. I know I've been waiting for this for a while. Okay, this is one of the positions. Notice Courtney's like shoulder shrugging, like she's completely locked in. Her knees are in a, I don't know what your knees are doing.
They're not in a great position. They're better than this, which
exactly.
I have seen. I've also oddly seen this.
Yeah, so now they literally like, look, all of this going forward, the heart is here. It has to go, the blood has to go from your heart down to your hands. In this position is not going much.
Nope.
Low oxygen means what? Muscles don't like it. They turn into beef jerky.
And my brain is already shutting down.
Well,
a little foggy.
Not enough oxygen going to your brain either in this position. Okay, perfect. So look, they could kind of probably see each other doing this stuff.
Yeah.
The question is, okay, they're super involved. This is a fight or flight reaction. They have to win. Their money, reputation, all that stuff at stake. I mean, what do they do? What do you suggest?
Well, ideally, you're going to try to set yourself up to start in a better position. You may move out of it, but at least you have the opportunity to stay in a better position longer. Something
is better than nothing. This is our philosophy here at Kinetix365. It's like, if you do this, I don't know, 20 minutes, that's 20 minutes more than you were doing before.
Yeah.
So don't beat yourself up.
So it's nice to sit up tall, clearly. Everyone knows somewhat about posture. Sometimes it's hard though, so you might put a little pillow in the arch of your low back, or you could roll up a sweatshirt or anything that you can put back there so that you can sit up tall. Have your screen at eye level, ideally, and have your knees bent past 90 so they're not back here.
That protects your knees, obviously, because if you have knee problems, I mean, that's really what it stems from.
Yep. And then for the wrist, you want to not be on this little area right here. The nerves and the blood vessels move through this area.
Guess what? It looks like a tunnel, right?
Yeah.
That's why it's called the carpal tunnel. Carpal means wrist in Latin. Tunnel is a tunnel. So.
And if you're putting pressure on that, you're blocking off that tunnel. Woo!
Putting pressure here is no good. You can paralyze somebody with this move. Don't try it at home. You want the pressure to be on the pad. This is why nature gave us these pads so we can game.
Yes.
Now
they knew so long ago.
But you can also, can they put it like a gel thingy?
Yes, so you could get a gel thing for your mouse or for your keyboard so that you can have a little bit more padding.
Less pressure on the tunnel is the key.
The other thing is you could elevate your keyboard so it's on a bit more of an angle so that the wrist is about a 10-degree angle, again, to open that area up.
Because this, closing the area is going to pinch that nerve. Keep it at 10 degrees up is going to open it up a little bit, hence the tilt.
And then the shoulders can somewhat relax more so that you're not in fight or flight.
At least not most of the time, okay? But again, do this some of the times better than none of the time. So these are principles you've seen before. It's like nothing crazy so far new. But then if you combine them together, they do actually make value. But here's the trick. Now, you're not only doing these bad habits while you're gaming, and let's say you game 8-9 hours a day, the rest of the time, what are you doing? You're either sleeping, eating, or holding your phone. So those are the places where you really have to change. Because if you're not in those positions when you're not gaming, then you can afford more gaming with less pain. So Courtney?
Yes. So, I mean, the phone, you're already, typically, you're bending the wrist here, your head is dropped down. Ideally, you would also sit up tall. If you can, get one of those little pop sockets or the rings so that you are not gripping the phone. Hold it here, and then you can use your other hand if you need to text, or even better, voice control of some sort, your Siri or whoever it is that you talk to.
Yeah. And well, the phone is a big one, like the pop socket versus the grabbing, big difference.
And
also, there's the sleeping.
So, try not to be in that fetal position. Try to let your knees be a little bit past 90. You want not to have your wrist like this, because again, that's 8 hours of compressing that same area. Maybe try to have the arm out beside you or down beside you so that you're not compressing that and the shoulders
like don't
are
waste those repetitive movements on banal things like sleeping and holding your phone. You can't afford that because you make money gaming. So not all of you, but some. But sometimes, I mean, we even have some patients who cannot get out of sleeping positions like this. And we've been forced to put them in like those skateboarding braces because it keeps them in this position. If you find yourself impossible to get out of this, try it out, okay? So sleeping, grabbing. Now, this is the basic advice.
Yes.
We have some tricks now for tips for releasing some of this stuff. Now, when people take breaks from gaming, they get up and they do this, they go have coffee. You need to do very specific breaks that are the opposite, the antidote of what we've been doing. And for that, we have a special exercise for you.
Yes. It is, we call it a micro break. It is also called a Brugger's exercise.
Brugger was the neurologist in Switzerland that came up with this position.
So, I mean, this is kind of most people's normal posture. You're gonna try to get tall from the chest, draw your chin back, and then get tall from the crown of your head. And then you're gonna spread your fingers and turn your hands out. And then you're gonna try to breathe into your belly. So as you inhale, the belly fills, and as you exhale, the belly goes out. Don't breathe with your shoulders. Again, that puts you in fight or flight. You want to breathe with the belly. 5 breaths. 2, 3, 4, and 5.
Now, for this to work, it's very important not to go into a military position.
Yeah, so you're not here.
Yeah. Your just hands are relaxed. The opening of the fingers and the turning the hands out. Literally, your brain is like your CPU. It works on zeros and ones. So when you do this, this shuts down the front and it turns on all of the muscles in the back. So that's very important because stretching doesn't shut down anything. It just gives you like scratching a wound. You're welcome to keep doing it. That just doesn't work.
But we need to balance this.
You need, exactly. It's the antidote. It's literally like a neurological thing. So pay attention to this. Then when you breathe into the diaphragm, what happens is that is the antagonist or the antidote to this. Otherwise, you're breathing from your neck, that's causing the neck trouble. So very important exercise. Every 30 minutes, which is the break you get typically in gaming, in pro gaming at least, you get up and you do this for 5 breaths. Okay.
And if you're not a pro gamer, every hour or two, try to get up. It's 5 breaths.
Get it in your schedule. Oxygen is good for you. Okay, so get it up there. This is going to help. Then there are a couple of releases.
Yes.
What do they need?
So you need some sort of tool. We have this. It's a little bit more grippy, so it grabs the tissue a little bit better. But it could be a lacrosse ball or a softball, any kind of ball that you have at home. The first one,
it has to be harder than a tennis. And And like, so a lacrosse or a baseball is ideal size, or this, we have this on our website if you're interested.
You're gonna come underneath your collarbone, right where it meets the shoulder. There's like a little divot there. That's where you're gonna put one of these balls, or your other ball. You're gonna lunge into the wall, and then you're gonna use that back leg to press up into the ball. This hand can keep it from moving. The arm that you're working on is just dangling, it's dead. And then same thing, 5 breaths or 30 seconds.
30 seconds would be ideal. If it's too painful, you could kind of shorten a little bit, but however many breaths you can get in 30 seconds would be awesome, because during this, you're opening this muscle, the pec minor, which sits right on the artery that brings all the blood to your hand, okay? We need that oxygen going down there, because remember, this is your athletic tool. It needs more blood.
And
then they do it on both sides.
Yes. And then the second one is the forearm on the palm side. So you're gonna take your tool and you're gonna roll up and down first. Same thing though, you lunge into the wall, and then you're using your legs to move up and down, not your shoulder. Do not use this, because again, you're stressing out all of those muscles going into fight or flight. 30 seconds.
So that 30 seconds, a regular ball doesn't work as well on this one, so you do need the 2 balls attached to each other, because then they sit right there. The up and down releases these muscles here, because these are the muscles that move your fingers. So whenever you're gaming, this is where most of the strain is, and that's why stretching doesn't work. They're just too worked out. Like, you gotta roll them, and this is it. And after that 30 seconds, they get to your favorite part.
Yes. Then you pick the most tight spot, and you're gonna rock side to side.
And this is the money move.
It's exciting too.
Yeah. This is the money move, the rocking side to side. The first one, up and down, you're just getting blood flow in there. The side to side, you're really separating all these muscles, these piano strings, from each other, so they can work independently from each other, giving you more endurance also, and more reflexes while you're gaming.
Good, and then you're done. You do it on both sides, clearly.
So, micro break, 30 seconds throughout, maybe every 30 minutes, 5 breaths. Twice a day, you do the ball here, and that should get you going. Now, not before we end this video, it's important to know that in some cases, because it's just to evolve the injury, if you have pain all the time, that means there's inflammation. And inflammation requires a specific different type of treatment, like anti-inflammatories. You add it to this, or some herbal supplements that also have anti-inflammatory effects. Also, sometimes that nerve can get really irritated and cause tingling or numbness in these 3 fingers, which requires, again, more evaluation. And we have some of these on our website, myKinetix365.com, if you need that information. Until then, good luck and good night.